and get him on here. Dr. Dan Edney, State Health Officer. Good morning, sir. How are you? Always a pleasure.
Good morning, Paul. I'm well. Thank you.
Yeah, I'm having a hard time on this one. Maybe you can help me a little bit. All appointments to boards and commissions shall be made in staggered fashions. We know that. Where a majority of the membership of the board or commission shall be appointed at the beginning of the 4-year cycle for elected officials. And that's where all of this runs into some acid reflux. When you appoint the vast majority of the people, they're going to be your people. The other people on there are going to be in the far minority. So you do give lots of power to the incoming governor, and that's not spotlighted in most of the conversations. But anything that you want to put into that, being a public servant there?
Well, the main thing, I understand the intent meant by the legislature with this, to streamline appointments and to try to bring some continuity and conformity to all the more than 100 boards that are in state government. But there are some boards that are very different, and one of those is the Board of Health. And the Board of Health has a very long track record. It goes back to 1877.
Yep.
So when you have boards that are overseeing large state agencies like Department of Mental Health and the Board of Health, those are complex entities, and you want to be careful how you handle the governance of those large agencies. When I came in as a new state health officer 18 months ago, I had a seasoned board that I could lean on, and my board chair was well experienced. And when we walked through that first year together, if you have a brand new state health officer and a brand new board of health, that can be tricky. And I don't mind telling you, it won't impact me because it doesn't kick in until 2028, but you're very likely to have a new state health officer in 2028, 2029, because I'm getting too old for this. And you don't want a brand new state health officer and a brand new board of health.
I think this encompasses just about everything except IHL and maybe a couple of others,
the things that are in the
vast majority.
Right.
Yeah. And when you start talking about that, you're just losing a lot of experience, and that worries me. Not from a Republican to a Democrat, it just is, number one, do we have people making the right decisions? If you want to know or worry about anybody coming in and being appointed because they contributed a lot of money, or they worked on the campaign, or they're breaking the glass ceiling, if you want the example of how that turns out, look in Washington, D.C. right now.
Yeah, and I would say is the first state health officer to come from the private sector that periodically having an infusion of private sector mentality in the state government is healthy. It's going to be very hard. It's going to be much more difficult to do that with shorter terms.
Let me ask you.
It would have been very hard for me to have agreed to leave private practice and take the income reduction with a very limited term, and also having to be confirmed by the Senate and not knowing if that confirmation was going to be successful, like we saw with Board of Education recently. It makes you think, 2 and 3 times before leaving the private sector.
That was the question. You answered it beautifully, and I think that transcends across everything, whether it's the Department of Rehab, Medicaid, no matter what it happens to be. People who are really qualified and who would do a good job for the people of the state. Mommy and Daddy would probably tell you, son, or daughter, you for 4 years you don't know if you'll have a job. Forget about it. You've built up a lot of experience and seniority, but it's worthless.
And this was not directed at the Board of Health or the state health officer,
I understand.
But it does incorporate all those positions. And I'm a big believer, we have enough things in state government that are broken. Let's don't mess with the things that are not broken.
Yeah. Well, and for years back when he was lieutenant governor, specifically in the 8 years that the lieutenant governor was the Secretary of State, we talked many times on the air and off the air about things like why we have a need to do this, to streamline the boards. But most of our conversations, Dr. Edney, were we need to cut some of these boards. They're useless. Now, the way I look at it, with majority House and Senate in the Republicans' hands, I do believe that we've increased the number of boards.
Yeah, so I think there's a lot of value in the proposed legislation. I do think it has some unintended consequences, which most legislation does. And there hadn't been an opportunity to really talk about the unintended consequences very much.
Well, I'm not sure what the House is going to do with this when they get it and take a look at it, but $27.99 is causing some concern from a lot of different sources. Daniel Sparks will be on with Gerard Gibbert a little bit later on today. They'll continue that conversation. And I just hope the right questions by the public are asked about this bill before they send it all the way to the governor. And who knows what the governor will do with that one. So let's talk about something a little more less mundane, and that would be the status of infectious diseases in the state. Would you please give me your 2 cents on bird flu?
Yeah, the important thing about avian influenza right now, H5N1, is it hits the poultry population periodically, and there has to be there's oftentimes a large die-off, but also a large kill-off of the poultry population to try to preserve it. If you remember, a few years ago, we had a real spike in chicken prices because of a reduction in the amount of chicken available, and that was related to a big flu outbreak. And there's increased outbreaks now, but the biggest issue is that we've identified H5N1 has jumped to dairy cattle in Texas and now Kansas. So we have a couple of dairy herds that have been infected, and we've had one, possibly two dairy workers who become infected. And when we see that occur, when we see it jumping species, and especially jumping into the human population, then it becomes a big concern. So we're watching that closely. Nothing in Mississippi right now. Texas and Kansas, where it's really occurring. And Commissioner Andy Gibson and I communicated yesterday, and we just want to make sure with anybody working with cattle, if it appears ill, then protect yourself. If you are a cattle farmer and you become ill, let us know so that we can get you tested. Thankfully, it's not a severe case of flu at this point in cattle or humans, but we do want to watch this closely.
But can you cook? It doesn't transit to the chicken, the meat itself, or the eggs, does it?
No, and with the dairy products, pasteurization will kill it. Yeah. So it's only folks that are drinking unpasteurized milk that we'd be concerned about. Of course, we didn't know if we were going to see the dairy herds dying from the flu, but we're not. Yep. They're getting sick and then recovering.
And this is different than swine flu.
It is.
As a matter of fact, and I mentioned this a little early, Ridgeland, Mississippi's based Cal-Maine Food said that around 1.6 million laying hens, 337,000 pullets were destroyed after the infection was found at a facility in our state. So look out for some chicken prices because they're probably going to go up. And
Paul, avian influenza is where we expect the super flu to originate when it does happen. So we watch.
How's it contracted by the chickens?
The same way. It's a respiratory illness, and it's highly contagious among various bird populations. And then it's harder to jump to different species, but once it does, then it's still highly contagious.
We got lots more to talk with Dr. Dan Edney about coming up right after this. Well, no, it's not number one, but it is a greeting and an opening for the new survey that just came out. You can't hide your flabby thighs. We are number 2 on this month's chart of the fattest people in the United States. West Virginia beat us. Was it?
Hey, that's incorrect. We're 45th now. We're not 50th.
Is it 45th?
We are 45th.
Here's the problem.
In the charts that matter.
Yeah, well, here's the problem. And you're right about that, because they issue these freaking things on an annual basis every 6 weeks.
Right.
There's a little bit of dichotomy.
Oh, please don't take the few wins I have away from me.
45th, that's not bad. So we are doing a better job, huh?
We are,
So good,
and
good.
it's more than just people getting fatter than we are. It's our obesity rates have been declining the last 4 to 5 years, and we've moved
Yeah.
from 50th to 45th. I'm
Hey,
mighty
come
proud
on,
of
look, we'll take those wins. When
Yes,
you start
sir.
looking at our educational level, at the economy just exploding in many different areas, and the incredible hometowns we have across this entire state, it's a lot of good things are happening. So thank you for your service and also mentioning that.
Well,
All right, speaking of which, we have a little salute because this week is what?
it is National Public Health Week, and I have a lot of our employees listen to your show. I always get shout outs whenever
Yeah,
I visit
yeah.
with you, and I really appreciate the opportunity just to thank them personally for all that they do every day in keeping Mississippians healthier and safer than they would be without us. The mission of our agency is to protect and advance the health, safety, and well-being of everyone in Mississippi. And I like to add, with no exceptions, I probably should have read that mission before I took the job because that's a heavy lift.
Yeah.
But it's an important one, and it's a mission worthy of accomplishing. And the good folks of the public health workforce at the agency are experts in getting the mission done. And I really appreciate their service every day, keeping us safe.
Forgive me for doing this, but in that same line, we have public employees who are already strained and worried about the news over and over about PERS. Do we need a bill like 2799 to add to that uncertainty in the future? It's not well timed, but just wanted to throw that in.
Yeah,
All right. As far as COVID or flu, where do we start on that?
We
one?
are doing fine. We are out of the worst of flu season. Our numbers are way down. It's not over. We'll have flu cases through May, and then hopefully, if nothing happens with H5N1, then we'll be okay until the fall.
You were going to say something else about 2799. I didn't want to cut you off.
No, I just I like to remind folks that we have a large public health workforce, and we are extremely happy to contribute to PERS every day using a lot of federal funds. We're 80% federally funded, and every one of those employees that's federally funded, those grant dollars go into PERS, and we are proud to pay it.
What does your department look like as far as hirings and staffing? Is it having a difficult time, or is it on par from where it used to be?
Everybody in state government's having a difficult time. I'm going to tell you a lot of challenges coming from the private sector into state government. Just doing normal things like hiring people and onboarding people is much more difficult in state government than it is in the private sector. It's very hard to compete with lower wages to start with, but then just the whole process of hiring state employees versus the private sector is I can't compete with the private sector for nurses and lab techs and healthcare professionals. I just have to find those who are passionate, who want to come to do what we do, and who are looking for a good work-life balance, because that is the benefit of working for us. If you're a public health nurse, you're going to work mostly 8 to 5 Monday through Friday and have good benefits, but you're just not going to get paid as well.
Yeah. Any highlight of any bills that are still remaining in the 2024 session that you're spotlighting or concerned about?
Well, we're doing well with public health bills. The Public Health Authority has been respected through the session, which we greatly appreciate. We work hard to provide the legislature the information that they need and the support they need as they're crafting legislation that has anything to do with our jurisdiction. We try to be good partners with them, as we do with those in local government and especially with county governments, with our county health departments. We're working really hard to get our little county health departments back open 5 days a week again, despite no increased funding. Our COVID dollars will be gone in July, so I'm having to reimagine how how to take care of local community-based public health services on a much smaller budget, but that's the benefit of bringing private sector thoughts and practices into things that we're doing at the health department to to work on efficiencies, reduce overhead, generate more revenue.
It's 7:40. It's 7:44 in the interview, and I haven't even asked you about Medicaid. Aren't you glad I didn't ask you?
Well,
I mean, what do you say about that? We've battered it around quite a bit. But
yeah.
any comments on the Medicaid expansion?
I'm grateful. I've been preaching the need for access to care to reduce our rate of preventable deaths. Our number 1 and 2 causes of deaths in Mississippi are cardiovascular and malignant deaths. And you have shared your story, and I've shared mine, and we are both beneficiaries of having good health care preventing us from dying unnecessarily.
Yes.
Because we had access to care. My father did not. He died of colon cancer unnecessarily. I would have died of colon cancer had I not had insurance and access to good medical care. And I believe you likely would have had the same outcome had you not had access to first-class medical care. And we need that for all of our folks, however we choose to do it. So I'm just so grateful that conversation is happening. Of course, we defer to the decision makers on what's the best way to do it. But in 18 months, we've reduced the uncompensated rate in the health departments from 70% down to 42%. But I still got to get that number way down to be able to afford to keep doing what we do. So, hopefully, as the gap closes, however it's chosen to do that, that's going to provide a lot of funding for public health that's desperately needed right now.
This curve with the cultural curve that we're on to find out exactly what tomorrow's hospitals look like in rural areas, you think we're getting there?
We are for a lot of our hospitals. Our larger hospitals, our medium hospitals are doing much, much better. Many of our rural hospitals aren't bouncing back like I would like to see. The enhanced Medicaid funding was very beneficial to the hospitals and was desperately needed. Our smaller rural hospitals just aren't benefiting as much. And for a lot of it, is looking at new models for them as well, such as rural emergency hospital status. Yep. And, looking, as everybody needs to do as we're doing at the health department, I have set our vision to 2030, not 2015. We have to look forward. What's it going to take to provide public health, core community-based public health services going forward, and not be fixated on how we did it in the past. The past public health funding is not going to occur again. I know that. I realize that. And I have to operate in that reality, which means we have to step it up on our end, which I don't think is a bad thing. I think we can do a better job at the health department to generate our own funding.
And I know it's outside your agency, but when we start talking to mental health, we've dropped the ball so many years, decades on mental health. It's good to see at least more attention is being spent on how do we fix this as far as mental health. It
takes a lot more funding. You get what you pay for. And we've gotten that in public health, and we've gotten that to a large degree with mental health. We've let third-party payers off the hook for too long, not being responsible for looking at mental health the same way we do as physical health, because the brain is an organ just like the heart, and it deserves the same level of attention, not just because of strokes, but because of mental health issues. Depression, bipolar disorder, schizophrenia, those deserve attention the same as any disease does.
So we opened up with a hack on social media site. Drinking oatmeal with lime juice and water is better than Ozempic. If anybody wants to try that, call me. Let me know how it works out. Dr. Dan Edney, sir, it is always a pleasure. I thank you for coming in.
Likewise, Paul. Thank you so much. And thank you to our public health workers.